1 in 4 babies born in England right now is being yanked into the world through an emergency cesarean. Not planned, not scheduled. Emergency, and nobody can tell you exactly why. Think about that for a second. You walk into a hospital expecting one kind of birth, and there's a 25% chance the script gets ripped up mid-labor and a surgical team is suddenly running towards you. That's not a rare complication anymore. That's a Tuesday. The BBC just crunched the numbers, and the picture is genuinely strange. Over the last 5 years, the rate of emergency cesareans in England has climbed sharply, not crept, climbed, and when reporters went to the experts, the people whose entire job is understanding why babies arrive the way they do, the answer they got back was essentially a shrug. There is no single clear explanation. Read that again. The thing happening to 1 in 4 mothers in one of the most data-rich health systems on the planet, and the smartest people in the room cannot point at one cause. So what's going on? Let's slow down, because the word cesarean gets used like it's all one thing, and it really isn't. A planned cesarean is a decision made in advance. You and your doctor look at the situation, weigh the risks, pick a date, and the baby is delivered surgically in a calm, controlled room. Everyone knows their role. Everyone's had coffee. An emergency cesarean is the opposite of that. It's the surgery that happens when labor has already started and something has gone sideways. Maybe the baby's heart rate drops, maybe labor stalls, maybe there's bleeding. Whatever it is, the plan changes fast and a team has to move. And in England right now, that scenario, that mid-labor pivot, is happening to roughly 25% of births, 1 in 4. The BBC's analysis makes clear this is a significant rise over just 5 years, not a generational drift, 5 years. Now here's where you have to sit with the discomfort. Because when a number like this moves this fast, your brain wants a villain. You want a clean story. Hospitals are doing it for convenience. Mothers are older, babies are bigger, doctors are too cautious. The experts the BBC spoke to basically said, slow down, because none of those single explanations holds up on its own. Let's walk through why each of those easy answers falls apart. The convenience theory says hospitals push surgery because it fits the schedule better. But emergency cesareans, by definition, are the unplanned ones. They're the chaotic ones. They blow up the schedule, they pull staff from other rooms. If a hospital wanted convenience, it would push planned cesareans, not emergencies, so that theory doesn't really explain the specific number that's rising. The older mothers theory has some surface logic. The average age at first birth has been rising for years. Older mothers do face more complications on average. But the curve of maternal age hasn't suddenly jumped in the last 5 years. It's been a slow climb for decades. So if that were the whole story, you'd expect a slow climb in cesareans too, not a sharp one. The bigger babies theory runs into a similar problem. Average birth weights haven't dramatically shifted in 5 years. They move slowly. The defensive medicine theory, the idea that doctors are reaching for the scalpel earlier to avoid being sued, has more traction with some commentators. After several high-profile maternity scandals in England, there's been intense scrutiny on hospitals where babies were harmed by delays in acting. So you can imagine a clinical culture that now leans toward intervening sooner rather than later. Better to do the surgery and explain why than to wait and explain why not. But even this doesn't fully account for the size of the shift on its own. And that's the unsettling part. It's probably all of these things, tangled together, plus things we haven't named yet. A system under strain, staff shortages, changing guidelines, a workforce that's exhausted, mothers with more complex health profiles arriving at labor. Each factor nudges the number. Together, they push it. But here's what should make you lean in. The experts didn't say, we know exactly why, and here's the fix. They said we don't have a single clear answer, which means a quarter of births in England are now ending in emergency surgery, and the medical establishment is still trying to figure out what changed. Now let's talk about what this actually means for a body, because a cesarean is often described in the same breath as a vaginal birth, like they're two flavors of the same thing. They're not. A cesarean is major abdominal surgery. The surgeon cuts through skin, fat, fascia, muscle, and then the wall of the uterus itself. Recovery takes weeks. There are risks to future pregnancies. There are risks of infection, blood clots, and longer hospital stays. That doesn't mean it's bad. Cesareans save lives, both mothers and babies. The rise of safe cesarean delivery is one of the great achievements of modern medicine. When you need one, you really need one, and you want a hospital that can do it well and fast. But there is a difference between a procedure being available when necessary and a procedure happening to 1 in 4 people who walk through the door. And that difference is exactly what the BBC's numbers are forcing England to confront. Ask yourself this. If you were told that a quarter of patients going in for any other reason ended up having unplanned surgery during their visit, would you not want to know why? If a quarter of dental appointments ended in emergency extractions, you'd want answers. If a quarter of eye exams ended with someone being rushed into theater, there would be a public inquiry. But because this is childbirth, and because childbirth has always carried risk, the number sort of slides past us. It shouldn't. Here's another thing worth sitting with. 5 years ago, the rate was lower. That means something changed in that window. Something about how labor is being managed, or who is giving birth, or what's happening inside hospitals during those crucial hours. And whatever it is, it's strong enough to move a national statistic by a meaningful amount in a short time. If you've given birth in the last few years, or you know someone who has, you may have lived inside the statistic without realizing it. You may have been told midway through labor that the plan was changing, that a team was on the way, that the baby needed to come out now. And in the rush of it, in the relief of holding your baby afterward, you probably never asked whether your experience was part of a national trend. It is. So what do you actually do with information like this? You don't panic. Panic doesn't help anyone, and certainly not a pregnant person reading a headline. But you do ask questions. You ask your midwife, your obstetrician, your hospital. You ask what their rate is. You ask what their protocols are for when labor stalls. You ask what continuous support during labor looks like at their unit. Because the evidence on continuous support, having someone with you the entire time, is one of the few things consistently linked to lower intervention rates. You also pay attention to staffing. Hospitals where midwives are stretched thin, where one person is monitoring several labors at once, are hospitals where small problems can become emergencies faster than they should. That's not a criticism of midwives, it's a criticism of the system around them. And you push back gently on the idea that birth is something that simply happens to you. The more informed you are walking in, the more you understand the choices being offered, the better positioned you are if the plan changes. But let's zoom back out, because this story is bigger than any individual birth. It's a story about what happens when a complex system shifts and the experts inside it can't fully explain why. That's rare. Medicine usually loves a clean answer. The fact that the BBC's reporting ends with a shrug from the specialists is itself the headline. Think about how many other slow shifts might be happening in healthcare right now that nobody has fully mapped. The cesarean rate just happens to be measurable, public, and easy to count. What about the things that aren't? There's also a question about what we consider normal. When a number moves from, say, 15% to 25% over a few years, the new number eventually becomes the baseline. People stop being surprised. Mothers swap stories about emergency cesareans the way previous generations swapped stories about forceps. It just becomes how birth goes. And the cultural memory of what birth used to look like fades. That's not necessarily wrong. Maybe this is the new equilibrium. Maybe modern bodies, modern pregnancies, modern hospitals simply produce more emergencies and the system is correctly responding. But maybe it isn't. Maybe a quarter of these surgeries didn't have to happen. We don't know. And not knowing is the problem. There's one more thing worth saying. If you've had an emergency cesarean, you might be carrying a quiet feeling about it. Disappointment, grief, confusion, even shame, especially if you'd hoped for a different kind of birth. Those feelings are common and they're real, and they don't get talked about enough. The data we're discussing here isn't meant to add to that. If anything, it should do the opposite. It should tell you that what happened to you is happening to enormous numbers of people, that you didn't fail at anything, and that the questions about why this is rising belong to the system, not to you. Because here's the thing, a statistic this big, moving this fast with this little explanation isn't a personal story, it's a public one. And the people whose bodies are inside it deserve more than a shrug. 1 in 4, that's the number to remember. 1 in 4 births in England ending in surgery that nobody planned for. And the experts, the ones whose job is to know, are still looking for the reason. So the next time someone tells you medicine has all the answers, remember this. Sometimes the biggest shifts in your body, in your family, in your country's hospitals are happening in plain sight, and the smartest people in the room are still trying to figure out what changed. The body is stranger than the textbooks, and so is the system built around it.